Being our full PPE. So whenever I go get my patient, I'm going to be watching their gait as they come back. All right, Mr. Campbell, you can come with me. Okay, and then you can have a seat there for me. Oh, do I need to lower this down a little? Good.
That's a grumpy old guy.
All right. Okay. So you can move the light out of your way, because you need to be looking at your patient and talking to them. Of course, this is done after your medical history, after the blood pressure, pulse, and all of that, okay? So whenever I looked at his gait, I noticed that he walked with a limp today. And so I would, write that down on my tray cover. I would have a pen, my pen that I brought in that had the barrier on it. I would write down, patient walked with a limp. And so as I'm looking at him and talking to him, I would be examining his face. So you need to vocalize to us in the assessments that, all right, I'm looking at his facial form and symmetry. Everything looks pretty symmetric. His skin looks clear. His ears, and you would move the ears to look behind the ears. And then you have to look at the hair. So pull the hair back to look at the hairline. You'll look at the nose, make sure that there's no scars or lesions. And then you'll just look at the lips at this point. You're just looking at that point, okay? With everything like the hair and stuff like that, you'll actually move those out of the way in the ears, okay? I'm gonna go ahead and get some gloves on. Okay, so now it goes down to the muscles. So this is where we need to make sure that we're taking notes for sure. I'm gonna have you hold that for me. All right, so under the muscles, the first one says mentalis. You are going to stand in front of your patient. You are going to have a thumb on the chin and then 2 fingers underneath the chin. And then you're just making circular motions with your thumb and index, or thumb and 2 fingers, okay? You're seeing if there's any hard nodules or anything like that. And I also forgot to say, before you start the exam, you need to tell your patient, and you'll do this during your assessment, say, all right, Mr. Campbell, I'm gonna do an intraoral, extraoral exam on you today. That's just looking for any abnormalities, okay? So that's how you would do that for your patient. Okay, so we did the mentalis. Now we're gonna do the masseter. So I'm gonna come behind my patient, and can you turn that page towards me? So I'm gonna stand behind my patient, and I'm gonna have them clench their teeth together. Clench your teeth together and keep it like that. And then you're just gonna palpate that masseter muscle, which is that cheek muscle, okay? And then we're gonna do the temporalis. I'm still standing behind my patient. Clench your teeth together again, and I'm palpating the temporalis. So remember, that's around your temples, okay? So now I move on to the paranasal sinuses. I'm still behind my patient, and I am going to have him lean your head back for me for a little bit. So I'm gonna do the frontal sinuses. So I'm standing behind him, and I'm taking my fingers and I'm walking across the forehead, okay? And then I'm gonna do the maxillary sinuses. So I'm palpating with both of my fingers on both sides. And during the whole exam, every once in a while, you need to ask your patient if anything was tender, okay? So now I can go to the submental gland. So I'm gonna go back to the front of my patient, and I'm going to have 4 fingers underneath the chin, and I'm going to roll his or her tissue up over that mentalis there, okay? And with that, your patient will have the tip of their tongue on their palate, okay? Tip of tongue on the palate, and then roll the tissue over the mandible. So then with the sublingual lymph glands, we're going to have the patient keep their tongue at the tip of their mouth, and then we're going to palpate with our fingers under the chin, so it's going to be like directly under the tongue is the sublingual. So we're just feeling there. Anything feel tender? Good. Okay, and then we're going to go to the submandibular lymph nodes. So we are going to stand behind the patient, and I'm going to push one side of his chin or neck to the other side. So I'm pushing to the left right now, and then I'm taking my left hand and I'm rolling that tissue the full length of the mandible over that bone. Okay, then I'm going to do the other side. I'm going to push. Anything feel tender? Good. So I'm going to do that. Let's see. All right, so now it's the parotid duct. We're going to stand behind the patient, have them clench their teeth together again, and we're going to palpate both sides. So the parotid duct that we're palpating is in front of the ears, but it's behind the masseter muscle. So it's like right in here. Go ahead and clench for me. Everything feel okay there? All right, so now we're going to do the preauricular lymph nodes. That is in front of the ear. So you're standing behind the patient again, and with the pads of your index and middle and ring finger, we're palpating that. Okay? All right, now lean your head forward for me, and this is the postauricular, so behind the ear. All right, and then just keep your head forward with your chin down to your chest for me, please. Now I'm doing the occipital lymph nodes, and I'm standing behind my patient. It's about 1 inch above and below their hairline that I'm palpating back here. Anything sensitive back here?
Feels great.
All right. So now I'm going to have you turn your head to the left, and I'm going to have you put your chin down. So the sternocleidomastoid muscle is this one right here. See how big this is? Right here. So the posterior cervical lymph nodes is behind the sternocleidomastoid muscle. So I'm starting at the top, and I'm palpating with circles all the way down to the clavicle bone. Okay? And then I'll do the anterior, which is in front of it. Like that. And then I'm going to palpate the whole muscle. So I'm putting my fingers around the sides of it, and I'm palpating all the way down to the clavicle. And then I'm going to do the other side. Chin down for me. This is that muscle right here. Can y'all see? That's that muscle right here. So the posterior, anterior, and then the whole muscle. Okay? Will you turn the next page? Okay, so now we are at the thyroid gland. So I'm going to stand in front of my patient for this. I'm going to palpate the gland using bimanual technique, where one hand supports the tissue and the other hand is palpating on the other side. And then I'm going to push it to one side, so the thyroid gland is right down here. Push it to one side, and I'm going to palpate it. And then I'm going to push it to the other side. I'm going to palpate it on this side. Anything tender? Okay, lift your chin up for me. And then I'm going to take the thyroid gland in my hands, and I'm going to move it from side to side. And this part grosses me out. It literally makes me sick. Okay, so just moving it from side to side. Okay, you might feel a little crunch when you do it. It's disgusting. Okay. Okay, so then we're going to place our fingers over the larynx and have the patient swallow for me. Good. Okay, and then I'm going to stand behind my patient, and I'm going to do the TMJ. Remember, we're placing our 2 fingers right in front of the tragus here. Okay, open for me and close. Open, close. Shift your left and right. There you go. And then protrude your jaw for me. Okay, is anything tender there? Okay, so what you're feeling for there is to see if there's any popping, any grinding, anything like that for that. Was that the last thing? Yeah. And so you just need to make sure that you're using all of your proper infection control and stuff like that. So we don't want to touch ourselves and then touch our patient with the same gloves, okay? So in all reality, you could use these same gloves to go straight into the intraoral, but I need to fix my sleeve and I need to do some other stuff. So I'm taking mine off, but you could leave it on to go straight into the intraorals.